Hi, it's Patrik Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So we're currently working with a client who has their 36-year-old daughter in ICU after cardiac arrest, after drug overdose. She's been in ICU now for about a week. The MRI of the brain says there has been some significant hypoxic brain damage done, and she's now also having seizures. Now, she was in cooling therapy initially, and how the intensive care team is saying after only about a week in ICU that if she does wake up, she will be a quote-unquote vegetable, and the only options are end of life or to do a tracheostomy and a PEG tube. Now, a week in ICU after such a dramatic event is not a long time, and even ICU teams don't have a crystal ball to predict the future. So the client wants to know, are there any other options besides moving forward with a tracheostomy and a PEG tube, or can she be extubated? Now, the reality is that and extubation means the breathing tube is being removed. Now, the reality is that if she's not waking up, she won't be able to be extubated. But the whole notion that this lady will be a quote-unquote vegetable is a terrible notion and should not be used by health professionals, because health professionals know better. There are neurological assessment tools, i.e. Glasgow Coma Scale, and it should be done, any suggestions around the future should be done around the Glasgow Coma Scale, and not with using inappropriate terms such as being a vegetable. Do an assessment on the Glasgow Coma Scale. If the Glasgow Coma Scale is 3, okay, fair enough, that's the lowest it can go. If it's an 8, it's somewhere in between. So it's about making appropriate assessments and not using terms that are degrading patients. So where to from there? The seizures need to be under control as a first step, and once the seizures are under control, then assessments can be made about how to wake up this lady. Can she wake up? How much time does she need? Is a tracheostomy the next right step? The reality is, if she's not getting a tracheostomy, she won't be having a chance of waking up. So it probably is a case of doing a tracheostomy, giving her all the time to control the seizures, and then let her wake up. Start with doing some physical therapy if that's possible, and then once the seizures are under control, then it's a case of starting to mobilize this lady and see whether she can or she can't wake up. It's a waiting game, and it takes time. Sometimes it takes weeks, sometimes it takes months. Who knows? But one thing is for sure, that if treatment is withdrawn, there is no return from that. And I want to leave you just with that thought for today. If you withdraw treatment, there is no return from that. If you do a tracheostomy, then, there is time for patients to be reassessed, and there is time for them to wake up to what is possible. That's my quick tip for today. If you have a loved one in intensive care, go to intensivecarehotline.com, call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com. Also, have a look at our membership for families in intensive care at intensivecaresupport.org. If you need a medical record review, please contact us as well. Also, subscribe to my YouTube channel for regular updates for families in intensive care. Share the video with your friends and families. Click the like button, click the notification button, and comment below what you want to see next, or what questions and insights you have from this video. Thanks for watching. This is Patrik Hutzel from intensivecarehotline.com, and I will talk to you in a few days.